Hello and welcome today to the 6th episode of Beneath the Shadows. I am your host, Travis Fenn, recording today as always from the comfort zone of the Shadow Realm, my office studio located here in Ypsilanti, Michigan. I'd like to start off by saying thank you so much to those who are coming back to listen to the show again, and welcome to those who have never been here before. It's a pleasure to have you here. Thank you for checking out the show. Thank you for taking the time to rate and review. And if you haven't done that, get over there and please give me some feedback. Please give me a rating, give me a review. Tell me how I'm doing. Let me know how you like the show. If you hate the show, go over there and give me 5 stars and let me know why you hate it, So, the feedback, immensely helpful. The positivity, always inspiring. Thank you so much. I'd like to take a moment to also give some updates regarding the show. I got some social media pages up. I think I've said this every show pretty much, but includes TikTok and Instagram along with a Patreon page that I'd like to release some episodes on. I believe I'm going to start on the 10th. I think it's a Thursday coming up here with 15-minute episodes every other week. So please keep an eye out for that. Please go ahead and give that a shot if you haven't yet. And other than that, the name on those is Beneath the Shadows for Patreon, Beneath the Shadows Podcast on Instagram and TikTok. There's also a Gmail address that is beneaththeshadowspodcast@gmail.com. So send email updates about yourself, send some topic suggestions, anything you'd like really there. I can read some on air if I get enough. Now, though, with that housekeeping out of the way, all taken care of, all tidied up, they might say, I'd say we dive into today's episode about the placebo effect. Yes, we're going to dive right in. The placebo effect. What is the placebo effect? Since the 1800s, the word placebo has been used to refer to a fake treatment, meaning one that does not contain any active physical substance. You may have heard of placebos referred to as sugar pills. The Scottish obstetrician, William Smellie, Mr. Smellie himself, in 1752, is the first person who uses the term placebo to describe a medical treatment. He wrote, "It will be convenient to prescribe some innocent placebo that she may take between whiles to beguile the time." I think it's beguile, B-E-G-U-I-L-E. It's beguile, beguile the time and please her imagination. A placebo is a substance or treatment which is designed to have no therapeutic value. Common placebos include inert tablets like sugar pills, inert injections like saline, and sham surgeries along with other procedures. Placebos have been around for thousands of years, though not called placebos, in varying fashions and are the most widely studied treatments in the history of medicine. Every time your doctor tells you that the drug you take has been proved to work, they mean it has been proved to work against a placebo. Despite their importance, doctors are not allowed to use placebos to help patients, at least officially, and there are debates about whether we still need them in clinical trials. Placebos are used in randomized clinical trials to test the efficacy or the effectiveness of medical treatments. In a placebo-controlled clinical trial, any change in the control group is known as the placebo response. The difference between this and the result of no treatment is the placebo effect, which is what we're focused on mainly today. Now, let's take a look at some trials, their results, some controversies and issues, and let's pull the placebo effect out of the shadows. The earliest example where placebo control was used is in a trial of Perkins tractors. In the late 18th century, an American doctor called Elisha, Perkins. Perkins developed two metal roddies. No, yes, it's okay. developed two metal rods he claimed conducted what he called pathogenic electric fluid away from the body. He received the first medical patent issued under the Constitution of the United States for his device in 1796. The tractors were very popular, and even George Washington is said to have bought a set. They reached Britain in 1799 and became popular in Bath, which was already a hub for healing because of its natural mineral waters and associated spa, which had been used since Roman times. Dr. John Haygarth, however, thought tractors were bunk and proposed to test their effects in a trial. To do this, Haygarth made wooden tractors that were painted to appear identical to Perkins metal tractors. But because they were made of wood, they could not conduct electricity. In a series of 10 patients, 5 treated with real and 5 treated with fake tractors, the placebo tractors worked as well as the real ones. Haygarth concluded that the tractors did not work. Interestingly, the trial did not show that the tractors did not benefit people, but merely that they did not produce the effect via electricity. Haygarth himself admitted that the fake tractors worked very well. He attributed this to faith. Other early examples of placebo controls tested the effects of homeopathy tablets compared with bread pills. One of these early trials revealed that doing nothing was better than both homeopathy and allopathic standard, which is like standard medicine. Allopathic? Allopathic? Allopathic. Allopathic. Spelling bee stuff. Another example of placebo tests comes in the form of placebo surgeries, which I think is absolutely crazy, absurd concept to me. Doing a fake surgery on someone, just imagine that. Imagine waking up, you feel better and shit, you find out your surgery was a fucking fake in the future. How'd that make you feel? Good? Bad? Not care? Weird? I don't know. So recently, placebo-controlled surgery trials have been used, in perhaps the most famous of these in 2002. American surgeon Bruce Moseley found 180 patients who had severe knee pain that even the best drugs had failed to work on. He gave half of them a real arthroscopy and the other half a placebo arthroscopy. Arthroscopy. Bitch. Arthroscopy. Knew it was wrong. Patients in the placebo arthroscopy group were given anesthetics and a small incision was made in the knee. Pretty much they did the whole procedure, quote unquote, or made it look like they were by doing similar cuts. But there was no arthroscope, no repairing of damaged cartilage, and no cleaning out of loose fragments of bone. So just cut you open to sew you shut, pretty much. From his medical report, a total of 180 patients with osteoarthritis of the knee were randomly assigned to receive arthroscopic debridement, which is removal of the bones, small fragments of bone, arthroscopic lavage, which is the cleaning out, I believe, of the damaged cartilage, or placebo surgery. Patients in the placebo group received small skin incisions, like I said, and underwent a stimulated debridement without insertion of the arthroscope. Patients and assessors of the outcome were blinded to the treatment group assignment, so they didn't know who was the placebo and who was not. Outcomes were assessed at multiple points over a 24-month period with the use of 5 self-reported scores, 3 on scales for pain and 2 on scales for function, and 1 object testing of walking and sitting and stair climbing. A total of 165 patients completed the trial. At no point did either of the intervention groups at no point did either of the intervention groups report. I can't fucking talk. What is wrong? At no point did either of the intervention groups report less pain or better function than the placebo group. To keep the patients ignorant about which group they were in, the doctors and nurses talked about the placebo. Jesus. To keep the patients ignorant about which group they were in, the doctors and nurses talked through a real procedure, even if they were performing a placebo procedure. And I'll tell you, that was a hard sentence for me to say. I had to go back and do that one a few times. The fake surgery worked as well as the quote-unquote real surgery. I don't know why I have that in quotes. It was a real surgery. The fake should be... it was a fake surgery. I don't know why I have that in quotes. It's weird. The fake surgery worked as well as the real surgery. As a review of over 50 placebo-controlled surgery trials found that the placebo surgery was as good as the real surgery in more than half of those trials. More than 25 out of those 50 came back. So it was, 25 plus. A placebo can work even if the patient does not believe it is a real treatment. In the first of the studies of open-label placebos where the patients know that they are placebos, 2 doctors by the names of Lee Park and Uni Covey gave open-label placebos to 15 neurotic patients. They presented the placebo pills to the patients and said, "Many people with your kind of condition have been helped by what are sometimes called sugar pills. And we feel that a so-called sugar pill may help you too." The patients took the placebos, and many of them got better after having the placebo, even though they knew it was a placebo. However, the patients were neurotic and a bit paranoid, so they didn't believe the doctors. After the placebo made them better, they thought the doctors had lied and given them the real drug. So, people not believing that a doctor healed them or doctor didn't heal them or found a way to heal them without actual medicine. Very peculiar circumstances that may mess with your head, especially if your head's already kind of messed up. So, more recently, several high-quality studies confirmed that open-label placebos can work. A study published in Science Translation Medicine explored this by testing how many people reacted to migraine pain medicine. One group took a migraine drug labeled with the drug's name, another took a placebo labeled placebo, and a third group took nothing. The researchers discovered that the placebo was 50% as effective as the real drug to reduce pain after a migraine attack. So 50% of the amount. So say at the first one, 10 people had good effects from the actual drug labeled with the drug's name. The placebo still worked, even though they knew it was a placebo, with, say, that would be 5 people, 50% as effective. So they had at least 5 people then. 50%. It's crazy, though, that the brain could push chemicals to the places that you need them due to just thoughts and, conditioning, pretty much. The researchers speculated that a driving force beyond this reaction was the simple act of taking a pill. People associate the ritual of taking medicine as a positive healing effect. Even if they know it's not medicine, the action itself can stimulate the brain into thinking the body is being healed. So someone can react positively to treatment from a doctor even if they know the doctor is giving them a sugar pill, which is, like I said, crazy, wild, absurd to me. Crazy and, wild. Many words for it. Many, many words for it. Extraordinary. Your mind can really be such a powerful healing tool when given the chance. The idea that your brain can convince your body a fake treatment is the real thing, the so-called placebo effect, and thus stimulate healing, has been around for a millennia. Now science has found that under the right circumstance, a placebo can be just as effective as traditional treatments. The placebo effect is more than positive thinking, though. Believing a treatment or procedure will work is great. It's about creating a stronger connection between the brain and body and how they work together. Research on the placebo effect has focused on the relationship of mind and body. One of the most common theories is that the placebo effect is due to a person's expectations. If a person expects a pill to do something, then it's possible that the body's own chemistry can cause effects similar to what a medication might have caused. Expectations of a patient also play a vital role in mediating a placebo effect. Expectations can impact the course of treatment by affecting the psychological and physiological responses to the treatment. Along with classic conditioning, expectations can be induced by verbal instructions or social learning. Conditioning involves either conscious learning, acquisitions and modifications of expectations or expectancies, or unconscious learning. Conditioning not mediated by expectancy. Expectancies can be acquired and modified by conditioning and other procedures, including verbal suggestions and observational learning. For example, a research subject treated for pain with a placebo in the context of a verbal cue that the placebo is an effective analgesic may shape their expectations and elicit an analgesic response. Analgesic? I don't know. Gesic? Conditioning and expectancy are often entangled mechanisms mediating placebo responses. Neurobiological mechanisms underlying the placebo effect are often and best characterized in placebo analgesia. Analgesia? An early study investigating the inner pharmacological... Damn, it's not even the right word. I got a word right, but that's not the word. Pharmacology of placebo mechanisms is John Levine and Newton Gordon's 1978 study of 51 patients who had impacted molars extracted. All 51 patients had received a painkiller called mepivacaine. Yeah, I think it's mepivacaine. Mepivacaine. I like mepivacaine. 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 For the surgical procedure. Then, at 3 and 4 hours after the surgery, the patients were given either morphine, a placebo, or naloxone. The patients didn't know which one they received. Naloxone is an opioid antagonist, which means that it stops drugs such as morphine and endorphins from producing their effects. It literally blocks the receptors, so it stops morphine or endorphins from docking onto those receptors, and it's used as a treatment for morphine overdoses. The researchers found that naloxone blocked the pain-killing effects of placebos as well. This shows that the placebos cause the release of pain-killing endorphins. Since then, many experiments have confirmed these results. Hundreds of others have showed that the placebo treatments affect the brain and body in several ways. The main mechanisms by which placebos are believed to work are expectancy and conditioning. Like I had mentioned, classic conditioning and expectancy are the two hypothesized psychological mechanisms that mediate the placebo response or placebo effect. Classic conditioning is a form of learning where an association is formed between a stimulus and a response. The association is then remembered, affecting future experiences. Through the process of association, patients may acquire a behavior. For example, a patient may report a decrease in pain after receiving a placebo pill that looks similar to the pain medication that was previously effective in easing that pain. Whenever the same stimulus is encountered in the future, the patient conditions themselves by shaping expectations and shows a previously imprinted response in their memory. Learning and adaptation, therefore, drive a conditioned response. Definitely drives that conditioning, definitely drives that classic, basic expectancy and conditioning. You get a lot of that going in the placebo effect here. In addition to these mechanisms, conditioning and expectancy, several other influential elements are at work during the placebo effect. These include the patient-physician relationship, the patient's psychological state and personality, the severity of the medical condition, and environmental circumstances. The patient's genetics may also influence the degree of the placebo effect. Researchers are studying how genes influence the placebo effect in various pathways, including dopamine, opioid, serotonin, and endocannabinoid systems. Evidence also indicates that the benefits of the placebo effect may not impact the pathophysiology of the underlying disease being studied, but rather address the subjective, self-appraised symptoms of the disease. For instance, in one study, people were given a placebo and told it was a stimulant. After taking the pill, their pulse rate sped up, their blood pressure increased, and their reaction speeds improved. When people were given the same pill and told it was to help them get to sleep, they experienced the opposite effects. So their pulse rate would decrease, their blood pressure decreased, and they were more lethargic and tired. Placebos won't lower your cholesterol or shrink a tumor by any means. Instead, placebos work on symptoms modulated by the brain, like the perception of pain. Placebos may make you feel better, but they will not cure you. They have been shown to be most effective for conditions like pain management, stress-related insomnia, and cancer treatment side effects like fatigue and nausea, which is awesome in some way. Placebos in clinical trials should ideally be indistinguishable from the so-called vermin. Vermin is a term used in clinical trials to describe drugs that contain pharmacological pharmacologically active substances. Pharmacologically. That's such a pharmacologically. Pharmacologically, yes. Vermin is a term used in clinical trials to describe drugs that contain pharmacologically active substances. In clinical trials, vermin is given to one group of subjects, while placebos are given to another group to determine the vermin's actual effect. This is to shield the test participants from knowing who is getting the placebo and who is getting the treatment, as patients and clinicians' expectations of efficacy can influence results. Researchers suggest that the placebo effect is caused by positive expectations, the provider-patient relationship, and the rituals around receiving that medical care. So, like the act of taking a pill, something of that nature. A study published online by PLOS Biology may have also identified what goes on in the brain during a placebo effect. Researchers used functional magnetic response imaging, MRIs, to scan the brains of people with chronic pain from knee osteoarthritis. Then everyone was given a placebo and had another brain scan. The researchers noticed that those who felt pain relief had a greater activity in the middle frontal gyrus, GYRUS brain region, which makes up about 1/3 of the frontal lobe. While it is still not known exactly how the placebo effect works, some of the theories that attempt to explain it include self-limiting disorders. Many conditions, such as the common cold, are self-limiting, that they will resolve themselves anyways. So someone may take some medicine, a placebo, whatever it might be, and the end of the symptoms is just a coincidence. Remission, some disorders, some certain diseases go into remission, and you may experience a time period where you don't notice that disease anymore at all, or the disorder seems to be gone, and that may coincide with placebos that have been given before and might not be due to the placebo effect at all. A change in behavior. Some people given placebos, such as sugar pills, take these for 30 days and you'll feel better. Also try to improve their life, so they may have an improved diet, regular exercise, may be responsible for easing those symptoms in that change of behavior there. Along with the change of behavior and altered perception may include some of that. So they may interpret, a sharp pain as a lighter pain, or may think that, their stress has decreased or something of that nature. So they may perceive things a little bit differently. That may also include, like reduced anxiety, which is the next one here. Taking the placebo and expecting to feel better may be soothing and reduce the levels of stress chemicals that the body produces, such as adrenaline. Brain chemicals, placebos may trigger the release of the body's own natural pain relievers, the brain's chemicals known as endorphins. And then altered brain state. Research indicates that the brain responds to an imagined scene in much the way it responds to an actual visualized scene. A placebo may help the brain to remember a time before the onset of symptoms and then bring out a change to the body. This is called remembered wellness. This theory is called remembered wellness. Depression, pain, fatigue, allergies, IBS, Parkinson's disease, and even osteoarthritis of the knee are just a few of the conditions that respond positively to placebos. The same appears to be true, though, for negative effects and is also known as the nocebo effect. If people expect to have side effects such as headaches, nausea, drowsiness, upset stomach, whatever it might be, some things of that nature, there is a greater chance of those reactions happening, with another negative consequence being that placebos can cause side effects associated with the real treatment. Withdrawal symptoms can also occur after placebo treatment. This was found, for example, after the discontinuation of the Women's Health Initiative study of hormone replacement therapy for menopause. Women had been on placebo for an average of 5.7 years. Moderate or severe withdrawal symptoms were reported by 4.8% of those on the placebo compared to 21.3% of those on true hormone replacement, which is a lower amount, but still having any withdrawal symptoms, severe or moderate, in the placebo is kind of crazy. But if your brain is releasing these chemicals due to this placebo constantly for so long, and then you cut it off, you're bound to get some sort of symptoms or withdrawals from that. Placebo effects have also been a subject of ethical concern in clinical practice. Additionally, the ethical dimensions of placebo-controlled trials, such as using sham invasion procedures, as I kind of said earlier, without withholding potential proven treatments or deception, are also issues of concern in studying the placebo effect. I feel like most people are behind it, but there's some crowds of people who really don't think you should have the placebo effect, and it sounds like it might mainly be around like those who are trying to push these medications onto market, but I don't know. I really don't have any idea about that. The fact that the placebo is tied to the expectations doesn't make it imaginary or fake. Some studies show that there are actual physical changes that occur with the placebo effect. For instance, some studies have documented an increase in the body's production of endorphins, one of the body's natural pain relievers, alongside increased production in other endogenous chemicals, substances that are naturally produced in the body, such as hormones, neurotransmitters, and cholesterol. Prior to the COVID-19 pandemic, about 1 in 12 U.S. adults had a diagnosis of depression. During the pandemic, those numbers rose to 1 in 3 adults, so quite a bit more. That sharp rise helps explain why $26.25 billion worth of antidepressant medications were used across the globe in 2020. Brain imaging studies showed that the brain has an identifiable response to the expectations and context that come with placebos. According to psychologist and placebo expert Irving Kirsch, who has studied placebos' effects for decades, a large part of what makes antidepressants helpful in alleviating depression is the placebo effect. In other words, the belief that the medication will work, will be beneficial, is beneficial to the person taking it. The U.S. Food and Drug Administration, The organization that regulates which medicines are allowed to go to the consumer market requires that all new medicines be tested in randomized controlled trials that show that they are better than the placebo treatments. This is an important part of ensuring that the public has access to high-quality medications. But studies have shown that the placebo effect is so strong that many drugs do not provide more relief than the placebo treatments. In those instances, drug developers and researchers sometimes see the placebo effects as a nuisance that masks the real treatment benefits of the manufactured drugs. That sets up an incentive for drug manufacturers to try to do away with placebos so that the drugs pass the FDA tests. The placebo effect is recognized as being powerful enough that the American Medical Association considers it ethical to use placebos to enhance healing on their own or with standard medical treatments if the patient agrees to it. Clinically, doctors use the principles of placebos in a more suitable way than is used in research studies. A 2013 study from the UK found that 97% of physicians acknowledged in a survey having used some form of placebo during their career. This might be as simple as expressing a strong belief in the likelihood that a patient will feel better from whatever treatment the doctor prescribes, even if the treatment itself is not chemically powerful. There is now even an international society for interdisciplinary placebo studies. They have written a consensus statement about the use of placebos in medicine and recommendations for how to talk with patients about it. In the past, patients who improved from a placebo effect may have felt embarrassed, as if their ailment were not real, may have felt, ashamed almost that they were healed by a quote-unquote placebo, or, quote-unquote real treatment. I don't know. That they were healed by this fake treatment, though, may have felt some shame or embarrassment for some reason. So now that we know a little bit about what the placebo effect is, let's explore how it works with your body and its natural chemicals. Natural products are a class of chemical compounds that are biosynthesized by living organisms, including humans. Endogenous natural products are produced by human cells as well as by the human microbiome. This contribution describes the current understanding and recent progress made on endogenous natural materials or natural products that are produced by human cells, including amines, steroids, and fatty acid-derived natural products. New strategies and technologies have been introduced that can be applied to identify and characterize those natural products produced by the human microbiome in terms of their composition and physiological function. Some of the most commonly known endogenous chemicals are endorphins, natural pain relievers, enkephalins, another type of endogenous opioid, either of two pentapeptides with opiate and analgesic activity that occur naturally, especially in the brain, and have a marked affinity for opiate receptors. Neurotransmitters like dopamine and serotonin, hormones like estrogen and testosterone, and cholesterol produced by the liver, all of which are substances naturally produced within the body. The placebo effect can cause the body to react in ways common to those associated with the treatment and procedure. The placebo, along with conditioning and expectancy, can influence your brain to release endogenous chemicals such as endorphins or dopamine, which, in turn, can help block pain or alleviate symptoms of depression, just as a quick example. Part of the beauty of placebos is that they activate existing systems of healing within the mind and body. And now, with the placebo effect nearing the end here, let's take a look at our main marks and wrap it up with our final takeaways. Number 1. A placebo is a substance or treatment which is designed to have no therapeutic value. Common placebos include inert tablets like sugar pills, inert injections like saline, sham surgeries, and other procedures. Number 2, placebos have been around for thousands of years and are the most widely studied treatments in the history of medicine. In medicine, placebos have been used since the 18th century to describe a fake treatment, meaning one that does not contain any active physical substance. Number 3, American surgeon Bruce Moseley found 180 patients who had such severe knee pain that even the best drugs had failed to work. He gave half of them real arthroscopy, I almost said arthroscopy again, and the other half a placebo arthroscopy. At no point did either of the intervention groups report less pain or better function than the placebo group. Number 4, a placebo can work even if a patient does not believe it is a real treatment. In the first of the studies of open-label placebos, like I said earlier, Lee Park and Uni Covey gave open-label placebos to 15 neurotic patients, and when they felt better, the patient thought that the doctors had actually lied and given them the real drug. Number 5, did you know hydrogen sulfide is an endogenous substance found within our bodies? Yes, hydrogen sulfide, a colorless, toxic, and flammable gas that smells like rotten eggs. A substance that's found in the environment and in industrial processes and can be harmful to human health. All right, now with our medical knowledge and vocabulary increased, we'll bounce into our final takeaways. So today, we looked at placebos and the miraculous abilities of the placebo effect. We dove into early placebos and learned how they developed into the phony, quote-unquote phony, treatments they are today. So I think that's the only time I use quote-unquote correctly today. From sugar pills to sham surgeries, the flower of the placebo effect. From sugar pills to sham surgeries, the power of the placebo effect ranges wide and far. The main uses for placebos seem to revolve around pain management and depression treatment, but can range to ailments like allergies, fatigue, and even IBS. We analyzed the placebo effect through a variety of different trials and reports and learned about some of the factors that can influence the effects. Through conditioning and expectancy alongside patient-provider relationships, the outcome and effects of the placebo can vary widely from negative to positive. And just remember, this podcast is your favorite and it'll help you through so much shit. It's just helpful to you in so many ways. It's just great. It's a wonderful thing. You want to review it and give it 5 stars. I don't know what that is. I don't know. Is that conditioning or expectancy or both or neither? Probably neither. With that, though, we've tackled the placebo effect. Thank you so much for joining me for today's episode. A little bit of a different one today. It got me out of my comfort zone, honestly. I was really very interested in the topic, but definitely put me out of my comfort zone. A lot of words I didn't know, and I honestly don't do too many pronunciation guides. I like to try to tackle them by myself and see how they turn out, and they did not turn out today. My tongue was tied. It's 9 o'clock right now, so it's getting there. I'm getting tired too. It's 9 p.m. It's, the evening time, relaxing, kind of trying to chill. I usually don't record at night, so it's a little weird for me, a little bit different. Kind of threw me off my vibe. Placebo effect got me feeling some type of way. Thank you so much for joining me today for this episode. I appreciate you all being here. Please head over and leave a rating and a review if you have not yet. 5 stars would be great. It is so immensely helpful, so incredibly helpful. I can't even express it to you. So please go and do that. At least give me a rating. Reviews are great as well. Tell me something about yourself. Tell me your favorite food, favorite color. Tell me your favorite place to go when you are pissed off at the world. Give the show 5 stars. If you hated it, go over there. Tell me why you hated it after you give me 5 stars as well. Just tell me why it's the worst. I appreciate you guys. Also, go over and check out social media. Instagram and TikTok are both up, and I'll be posting more consistently on them starting here in October. Though I've been keeping up with the Instagram, I haven't done as much with the TikTok, which I'd like to get into, so I'm going to start tackling that as well. I can't say thank you enough to everyone who has given the show a chance, and thank you again to those who have come back and stopped back to check out another episode. There is also a Patreon you can follow if you'd like any more episodes, shorter episodes 2 to 4 times a month, about 15 minutes to 20 minutes on those episodes. Every other week is what I am going for, starting on the 10th, I believe. It's Thursday this upcoming week. I'll be posting those shorter episodes. The name on that is Beneath the Shadows. The name on the Instagram and TikTok is Beneath the Shadows Podcast. And there is a Gmail as well. You can send updates, personal reviews, or anything you'd like to, really. The name on that is Beneath the Shadows Podcast at gmail.com. So please go ahead and give me some updates. Finally, let's take a look ahead. A look ahead to next week. Next week, we will be headed all over the place as we dissect the craziness behind murderous mothers. We'll talk a lot about filicide and infanticide, along with a lot of murderous mothers in particular. I'm going to do killing fathers, or, trying to think of a good title for it, but killing fathers at some point too. But when the matriarch of a family decides to end the life of her child or children, what could possibly be the cause, and why would a mother want to remove her child from this world? We will look into a handful of cases, medical analysis behind infanticide, and the outcomes of the murderous mothers following their heinous crimes. So, this week, we learned that if you condition yourself and expect happiness out of life, you may be able to trick your brain into producing some more serotonin or dopamine. So, give it a shot. Just look at things a little bit differently, see if anything different happens. Now, though, don't go about committing infanticide. Go review the show. Remember, the show is bringing you all to a better place. You all love the show. Placebo. Ooh. Something like that. Placebo is going to get you. I'm telling you, you're going to love the show no matter what. Even if you hate the show, you're going to love the show. Have yourselves a fantastic fucking week, a great fucking week. I want you all to have the best week of your life. Like, when you look back, when you're 87 and a half years old, and you look back on your life, and you're like, what was that one time? This upcoming week. That's what I want it to be for all of you. So have a great week. Have a great fucking week. You're all the best. Peace out, my shadow people.
Bow, bow, bow. Bow, bow.